Hi, I'm Audra Burns from Dartmouth Health. Welcome to Heads Up, a year-long mental health awareness journey, Dartmouth Health's webinar series, which focuses on important mental health concerns and topics that affect all of us. Today, we will discuss the unique mental health challenges of our military veterans and active duty members of the military. So the goal of this year-long series is to help change the conversation around mental health and to end the stigma associated with it. Mental health is a significant issue among our nation's military veterans and active military members. The VA reports that 17 veterans commit suicide each day in the United States, but some studies suggest that that number might be even higher. From post-traumatic stress disorder or PTSD to re-entry to civilian life, substance misuse, depression, and other issues, a large portion of our veterans struggle with. Active duty members of our armed forces also face significant mental health challenges. So I have two really great panelists here with me today to discuss this really important conversation, and they have a unique perspective that they can offer. First, let's meet Dr. Evan Bick. He is a clinical psychologist at Dartmouth Health and a U.S. Army veteran. Hi, Dr. Bick.
Hi, how are you?
Also joining us is Patrick Jordan. He's the Chief Operating Officer at Dartmouth Health and a U.S. Army veteran. Welcome, Patrick.
Hello, everyone.
So, Evan, I'm going to start with you. First, thank you for your service. What can you tell us about the unique mental health challenges our veterans and active duty members of the military face?
I think there's a couple of things that may put veterans or active duty service members at an increased risk of dealing with different kinds of mental health challenges. And the first is some aspects of just sort of the nature of military service itself. I think when we think about the mental health challenges of veterans and service members, we often sort of immediately think about PTSD, about post-traumatic stress disorder, which as the name sort of suggests is a kind of collection of different mental health problems related to having been exposed to different types of sort of extreme experiences. And military service, by its nature, sometimes leads to service members being exposed to combat, to extreme violence, to different forms of trauma that can be difficult to sort of process and come to terms with in a way that works. I think there's some other aspects that are worth talking about as well. One is some of the ways that the culture of the military can sometimes make it difficult to talk about mental health problems and to talk about acknowledging some of the issues that service members or veterans may be struggling with. And finally, I do think it's worth noting some of the challenges that service members themselves or their families may deal with in terms of both separation when it's sort of during a deployment or during sort of extended training, or as service members sort of leave the military and are working on ways to integrate themselves into sort of into the civilian world in a way that allows them to build the kind of life that they're looking to build.
You bring up such important points. I think one of the things you mentioned was about how the stigma of bringing it up within the military groups and the purpose of this project that we're doing with Heads Up is thinking the stigma, breaking the stigma just for everyone to know. So it's interesting to know that it's not just so broad, it's these pockets of organizations that within those organizations, the members that they have are also struggling with that. And I think that's important for their loved ones to know as well. So thank you for sharing that perspective. So now, Pat, let me turn to you. Thank you so much for your service. And I would love to hear, a little bit about situations that you faced on active duty that challenged your mental health or the health of your fellow service members, and what kind of support did you have at the time?
Yeah, I served in the 82nd Airborne Division for 8 years. I deployed to Panama during the invasion there, and also the first Gulf War. But to Evan's point, I was thinking, we both are graduates of the U.S. Army Ranger School, which is the premier Ranger course or leadership training in the Army. 57 days of no sleep, no food. And what we learned there was to really drive ourselves and drive our people and our mission. So, I think about the mental health availability to us. I think, I was in the mid 80s, it was pretty limited. And any mental discussion of mental health was how to make yourself tougher and stronger so that you could drive on with the mission, take care of your soldiers and accomplish the mission. So I can only imagine that the military has grown leaps and bounds in that regard over the years, given some of the issues, but it certainly can be a challenge.
So that makes me think about the difference with, returning back to home. And so let's talk about your experience returning home from deployment and how that might differ from National Guard, who immediately return home and they're right into family life, civilian life, and jobs. I mean, how does that differ?
I think that's a great point, Audra. When I returned from Panama in the first Gulf War, I was still in the 82nd Airborne Division. There were 32,000 soldiers at Fort Bragg, where I was stationed, that we could, be comrades with and share our stories and share the pain that we might have. I often wonder about these folks that are in the Army Reserve or the National Guard, who first off get a culture shock when they go back on active duty full time, deploy, maybe are in combat operations. And then as soon as it's over, they are back on Main Street in the United States of America. And I can only imagine that is significantly more challenging than those of us that had the support and colleagueship of being in active duty at a military base.
And that's a great segue into a topic I want to discuss with you, Evan. So knowing when they come back and the support that they're going to need, what are some signs of, mental health concerns that maybe loved ones could be looking for their service members or their veterans, and where can they turn for help?
Sure. I think this is something that's really important for all of us, veterans or service members or civilians or family members, to sort of be aware of all the time of sort of what are some of the signs that might help me recognize that something is going on here, that there's something here that's not working, and that I might want to change. Some of the symptoms that I think are particularly sort of, kind of noticeable or important to pay attention to are things like increased sort of frustration or irritability or anger. I always want to ask about sort of changes in sleep. People are sleeping more or sleeping less. Just sort of subjective changes in mood. I notice I've, feel more down, or I'm, pulling away from other people, or sort of not saying, saying no to things that I used to be saying yes to. Might be a sign that it's worth having a conversation with a family member, with a trusted friend, or a mental health provider. I do also think it's important to acknowledge sort of changes in sort of substance use, whether that's sort of, increased use of alcohol or increased use of other drugs that might sort of serve this role of kind of trying to kind of control emotions in a way that sometimes can work in the short run, but ends up having some longer term consequences. Pat had made a really important point about some of the ways that the sort of culture within the military tends to sort of make it difficult to acknowledge ways that we might be struggling. The point I like to make a lot is to say, when I was in the military, I'm not going to tell you that my knee hurts, much less that I'm sort of feeling depressed, or that I'm feeling like I'm struggling with different aspects of service. And I think being willing to do something that might feel really hard, might feel really challenging in the moment, and reach out to somebody and say, something here is not working. Something about this, the way I'm dealing with my experiences, or the way I'm dealing with this sort of transition into civilian life, it's just not working right now, and I need to think about ways to do something different.
And you offered some really great signs to look out for those caregivers, because it might be the caregiver or the loved one that might be the one who notices the signs and can advocate for them to get their help. And for our viewers, we'll be sure to have a link to resources at the bottom of this video. So Pat, what was it like for you when you left the military and transitioned to civilian life?
Yeah, so, between my reserve time when I was in college and active duty time, which was 8 years, I was in the military for 11 years. And I think I'm a very lucky person because my first job out of the military was in healthcare, working at Massachusetts General Hospital. And I guess I was about a year out when I started realizing something was not exactly right. And I happened to be very fortunate that one of my senior leaders had great contacts in the Mass General Hospital of Department of Psychiatry. And I quickly met a psychiatrist who has been very helpful to me through the years. I don't think this is a one and done issue. This stuff can crop up and periodically hit you. And that psychiatrist has been a resource to me for years. And not just about things related to the military, but things in my personal life and challenges that we all face every day. And one of the great things, though, is what I think has evolved in healthcare over the years. Going back to my original employer, I think about the home-based program at Mass General Hospital and how extraordinary that is in treating veterans with traumatic brain injuries and other mental health issues. And it's absolutely free to veterans, sponsored by the MGH as well as the Boston Red Sox. But then I think about the incredible resources that we have at Dartmouth Hitchcock, both in our EAP programs. We have a dedicated military employee resource group that brings veterans of all walks of life together, people that have commonalities in their deployments, their training, and they meet on a regular basis to talk about what's important to them. We celebrate our veterans in many different ways. To include, on Friday, we have a big event for Veterans Day. We have a wall of honor at Dartmouth Hitchcock where we post the pictures of all veterans that are willing and talk about, what their experiences were and what they've done since in their civilian life. We get awards all the time working with current members of the National Guard and Army Reserve for our policies and how we take care of them while they're serving both roles as employees at Dartmouth Hitchcock, as well as serving their nation. And finally, we've worked very hard to recruit veterans across New England to come to work for us. We know how good they are. We know how results oriented they are, and we just love getting them. And we need more right now. So.
Yep. We certainly have a great group within our Dartmouth Health system, and it's so powerful for both of you to be sharing your very personal experience on this topic in hopes that the viewers or loved ones who might see this it's going to help them open up for themselves. So thank you so much to both of you. So before we wrap up, I'd love to know just a quick takeaway from this conversation that you really want to have our viewers understand or learn from. So Pat, I will start with you.
I think it's hard to ask for help, but I can tell you through my own personal experience that once you've asked for that help and you begin talking about the things that you're feeling, it makes a huge difference. So please don't hesitate to ask for help.
Wonderful. And Evan?
I think alongside some of the points that Pat just made, I think it's important to kind of recognize that, one thing that makes it sometimes a little bit easier to think about reaching out for mental health care is recognizing that, we in the military as veterans, as healthcare providers talk a lot about physical fitness, about physical health, and I think recognizing that that mental fitness is sort of part of your overall health, is part of your overall fitness, and is important, and is something that that we're really able to make sort of positive contributions and work with people who are seeking help to really see some positive changes. I think the only other thing I would add is we sort of have this balance of talking about the unique sort of mental health challenges that veterans and service members may face. And alongside that, I think I want to sort of reinforce what Pat said, which is to highlight a lot of the sort of strengths that people have been able to bring out of their military service, or able to bring into, whether it's sort of working as a civilian at Dartmouth Hitchcock or in any kind of line of work. I think this is this is a group of people who with a lot to offer.
That's the perfect closing for it. They do have a lot to offer, and I'll be sure to link to our resources and available job postings that we do have within our Dartmouth Health system. So thank you so much to both of you, not only for your time here, but for your service and your insights. It's been a wonderful conversation. So thank you both.
Thank you, Audra.
So to view past Heads Up segments, you can visit at the link you're seeing on our screen, and we'll have our resources posted below this video. Take care.